to all of you. So maybe I just introduce myself before we proceed further. Yeah. So Wan Osham is my former teacher in Form 6 also back then in St. John Institution. So this is like 10 years ago. So currently I'm a frontliner, which serving in ambulance service and also as well as the PPV in which is the Pusat Pemberian Vaksin in KLCC at the moment. So yeah, experience wise, there are a lot. Yeah, so maybe you may want to know which kind of experience that you want from that you want to know more from me. At the moment, I'm not a doctor, but I'm assistant medical officer, in which is known as Penolong Pegawai Perubatan, which registered with Kementerian Kesehatan Malaysia as well. So yeah, I may need, maybe you can be specific. I can share whatever I the Izinka, whatever I able to lah. Yeah. Yeah, maybe from beginning how I get involved in all this. Yeah, okay. So back then, actually, I'm from St. John Institution. So we start the movement on very young, from one itself, maybe like all of you as well. So we do likely St. John's Ambulance and Red Crescent doing almost the same thing, but what in specific, maybe in the national organization, there may be specific St. John come under the Ministry of Health, whereby Red Crescent is Kementerian, what do you call that? Kebajikan. So yeah, but when we come to school time, first aid we learn and everything will be the same. So 6 years, 7 years in the school, of course, I'm with St. John. Then day after I left the school, I continue working with St. John Ambulance Malaysia. So in which I'm the staff there, which is working with them. Not long later on, I posted to Penang and all that for further training. And of course, I took my before I become an assistant medical officer, I go to Philippines to do my subspecialization in emergency. So concurrently, I'm an EMT, emergency medical technician. So that actually, why do all that come in my mind and move more? Basically, I come from a background whereby my family, most of them is volunteer as well. Yeah, so just play different role. But me myself, I'm more interested maybe in medical. So when you talk about medical, you want me to earn for good over there. Maybe it's not me, but whereby my dream is to do this full-fledged like a volunteer and to help whichever I'm able to. Like, yeah. So after I came back from Philippines, I continue working with St. John. So back then, if you ever heard of currently Gamuda MRT, the project, the underground 7 station is my first project after I come back from Philippines. So the 7 station project, whereby we need to learn hyperbaric and all that. So that enhanced us further. Just not something on land, but it's something on underground. So we learn further from that we're able to help more. But of course, with all the skills and experience, no one knows that pandemic will come by at this very moment, and no one is prepared actually in medical field. Yeah, but of course, in a sense of we said we are prepared in what books have taught us, but in experience wise, no one know all these challenges may trigger at this very moment. Yeah. Beside that, when you talk about experience wise, what driven me more is basically the passion to help the last, the lost, and the least, most important. Because in medical, if you're thinking of this money orientated and all that, it is a bit too difficult for you to move on. Of course, yes, it's you must be sustainable, but how you be sustainable and how you move on, that is must be a very constructive way that you have to plan, and so that it is sustainable for you and to build your family in future as well. Yeah, so of course, we frontliners always one thing that in our passion as well, like myself, I like to share and train more. Yeah, so we always believe that with just one of us we can help 10, but if it's 10 of us, no first aid, what they call that, the knowledge and skills, we're able to multiply more, and therefore more people will deserve the proper care. In other country, you may foresee that actually they have this policy that they encourage every family to have one first aider or medical staff at home is the best, or at least they know CPR and all this. So when come to emergency situation, things is a lot of difference, whereby when you have a family which no medical knowledge at all, so we're able to handle more. And of course, life is precious and crucial to help in emergency situation. So that we should actually look forward to be ready all the time, yeah, instead of any other things that you just prepare there. But the knowledge is important. Yeah. Yeah, Casey, maybe that is just briefly that what I able to share. But if you were able to have a specific area that you more interested in and all that, you may just put question to me as well. And of course, not only Casey, with your team, all of them, anyone who are able to just stop by me and just would want me to share further, no problem. On the pathway wise, how you're going to do it and all that. Me myself, to be very honest, I'm not from science stream. Yeah, it's something different that I want to share to you all on this as well. So by my counselor in form back then to form 5, I think most of the school and all that, they would say if you are from art stream, you were not able to go back to something to do with science and all this. So in the end of the day, I would just say it's within you want or you don't want only. Yeah, of course, the way that if you are from art stream and all this is going to be a bit tough, but when you have the interest, whatever challenges will come through. Yeah, so why am I not in science stream back then? Because I'm from I think Puan Osha may be able to share to you, she's from SJI as well. So we are from the school that sometimes we don't make our own decision, whereby because our school want to maintain the good name. So my form 3, I don't do that well back then. Yeah, and of course up to form 6, I don't really the kind of person who just stay in class and all that. My form 4 supervisor used to say, you can find Eugene everywhere in the school, but not in the class. Yeah. Yeah, so that is basically me. So I will be very active in anything, but when helping people and all that, that's a passion. But when it comes to staying in the class, not me, but prepare for exam, of course, is our duty, our role. Then I will, okay, really sit quiet there and then just study for the exam and all this. I think all students do that as well. No harm done, but of course, in the meantime, you can actually learn more while you are just away from the book. I'm not encouraging you all to just stay away from the books, but books is a guide, but implementation is more important in many things in life. Yeah, so that's why you will see nowadays, maybe like degree holders and all this, even doctors come up, they may have hard time to implement things. Yeah, so the critical thinking is important. Myself, I like all these challenges. That is why I choose among all, I'm in emergency, because emergency every day we may foresee that things that we encounter is absolutely different. You can't expect what you have in any emergency calls. Yeah, begin like last year pandemic, we do have a calls because that time I don't put under the COVID team, so we basically don't prepare that go for any COVID case. So we have case like stomach ache, but end up we ourselves got quarantined back then. Yeah, so because they never tell the truth as well, they don't know, they just thought of I have asthma, it's just a normal difficulty of breathing and all this. Everything is no such thing as pre-prepared and all that, just that we have to be ready and go. Yeah, so back then my very first case of doing delivery for a lady, the call just came in like she have stomach pain. Yeah, so we are not supposed to go because there are hospital ambulance with bidan inside and all this, call it to do the proper procedure. So we are there, and this is the lady, 9 children. So it happens so fast. The first minute we arrive, second minute we can see, I just hear something like someone licking the finger. This baby is really healthy. Immediately have bloop up. Yeah, so we just prepare everything, let go, and the structure is not even there yet. We thought of just send to hospital as soon as possible. It just happened in front of us that soon. Yeah. So it is an interesting pathway that if y'all would want to, after your Red Crescent, after you go for Form 6, you want to go for your medicine program, you want to go for anything related with medical as well. Yeah. If of course, if you have any issue on your result and all that, I don't mind to share you all to go to medical. You need not to be your result orientated absolutely good and all that. There are many other ways. Yeah. So and it's not even if it's you are doing private, you are not lucky to get in government. It's fine, no problem, because nowadays it's very safe at this pandemic. They do have their class online as well, so no big issue for practical wise will differ later on. So of course we hoping the pandemic to go well as soon as possible, but don't let what they call that, the pandemic to stop what we want for the future. Yeah, because we need the younger generation to actually fill in for us. We won't able to just sit in the front line all the time. Energy will exhaust out as well. So very crucial to have many others to come in and help as well. Yeah. Casey, maybe you can just trigger me with some question. Yeah, my part, I think more or less I would able to share is that one, just like what I mentioned, but may have more as well. I unable to just group everything in one day because there are so many years. I don't know where shall I and to start up with to share actually. Yeah.
Can I ask a question?
Please,
Right.
Chloe. Nice to meet you. Yeah.
Hi, nice to meet you
Hi.
too. All right. Actually, can you explain to us like what is the specifications of your job right now? Like as of right now, how does your day go? Like what do you do as like for your job?
Okay, right. So just not to be too surprised with what am I doing. So because the daytime, I'm long hours in PPV, so I'm the team leader there in one of the stations. So whereby I just mentioned I do ambulance service as well. So ambulance service wise, I'm doing coordinating, and if needed, nighttime I will be on call from after I off my PPV scope, then I will join with my team and do a midnight shift until the morning 7 o'clock. So PPV basically we be there at 8 or 7:30. So that is all the way to evening. We prepared everything. After all done, last patient at 8:30. Then I will continue. But of course, my night shift they allow us to rest because we are doing ambulance service. So when they are off call or cold timing and all that, we allowed to rest. Yeah. So yeah, that is at this moment, current moment. Yeah. So before coming to this, that actually started on the May. So before coming into May, I'm not in PPV previously. So for the past 3 years on the daytime, I'm because I mentioned I would rather do medical as like my volunteer and all this. So I basically do volunteering in ambulance service. Yeah. So I'm basically taking care of the St. John ambulance for Wilayah, what they call that, their operation side and skills and all that. Yeah, so that is on volunteer basis, and we known it as regular volunteering. So on daytime, I'm basically period from been 3 years. I'm teaching in one of the college to prepare medical students before they take their first year medical program. Concurrently, we will actually guide them how and what to do next after their graduate and all that, what to prepare before they go on. That is during their foundation, what they call that, period of time. But unfortunately, because the pandemic is really bad, so sized down, so I actually stopped that on the May. But however, if any one of you happen to be interested to study in medical and not lucky enough to get government seats, don't give up hopes. Yeah, you may able to continue as well. After all, what do you call that? Financially, is something that always able to find some solution is within that our willing level, we want it or we don't want it. Yeah. Hi,
Okay.
Chloe. Yeah, if you have any other question, you can, and if I'm not answering your question, you may able to just post me again. Yeah.
Okay, okay.
Yeah.
Yeah, you answered the question, no problem. I just want to know what's PPV.
PPV, Pusat Pemberian Vaksin. Yeah.
Oh,
Yeah.
okay, okay,
Yeah, which
understood.
is where you get your jab and all that at this moment.
Okay, okay. Uh,
Okay.
so before the pandemic,
Yeah.
were you still volunteering?
Yes,
Yes,
yes.
you were.
So before pandemic, I'm just volunteering at night shift. So happen to be 7 shift at night. I basically cover 5 or 6 shift most of the time.
Don't
So
need
that
to
is
steal.
yeah, my timing. We able to have timing to rest. Are we allowed to rest? Yeah. So my shift basically start at 7 to 7. So office hour is 9 to 6. Yeah. So that is how we cope with it lah. Yeah. Yeah, kind of no choice situation because from last year pandemic itself, the what they call that, we really short of manpower. Me ourselves and my colleagues, all of us take turn to be kind of like kena quarantine and all that. So no choice, seriously. Yeah, there are one time that I don't go home for about 5 or 6 months. Although my home is like just stone throw away from my where I work, but we just don't go home. Yeah, yeah, yeah.
Okay, so I just like to ask this
Yes, please.
aside from the COVID part, okay?
Yeah, yeah,
Because before this you worked, you volunteered, right? So
yes,
in the ambulance and everything,
yeah.
yes. So is there something that uh, is there something that you like people to know, like what preparations you need to make, like while the ambulance is coming? You get what I'm
Oh,
saying?
okay, okay.
Yeah.
Well, very good area to cover. Yeah, so basically, when you talk about like emergency situation and all this, of course, it will be it's a very panic situation for most of the people at home and all this. So instead, and listen to rumors, what to do and all that. In Malaysia, although sometimes may a bit lack of time, but 999 is still the best direction that we call, whereby they know which ambulance facilities available nearest to you. So hence, the preparation start very situation not while the ambulance coming from the anyone fall sick which needed ambulance. Then we have a flow which known as DRABC. So in between the calls is important. So because the time for the ambulance to come, so information fit to the what we need to answer is important because in panic situation we just so nervous, so anxious that our mind don't go in order sometimes. So we need to just let them know our situation, direct them we need ambulance. Yeah. What is the situation and all that, we have to be calm and just let them know. So while waiting for ambulance wise, we have to just monitor their vital signs if you're able to. Of course, if you are learn in Red Crescent on first aid and all this, we have your vital sign monitoring and all this. Just monitor patient until the ambulance arrive. Of course, that is in normal situation, but if it's in very critical situation whereby you need CPR, MERS Malaysia, MERS 999, in which is the 999 call center, that will basically now we have instruction to actually get you through our SOP. We have to teach the caller how to start CPR before the arrival of ambulance. So that is very important because the compression actually triggers the heart to move, whereby if we don't do that, an ambulance reach even as soon as just 10 minutes of time, it is still very difficult for emergency personnel to do anything because the crucial time is the first 4 to 10 minutes. Yeah, so what if it is totally shut down the system? So we basically have hard time to do anything as well. So that's why in other country, if you all learn CPR, compression is important. So you all can start it with just compression. If you don't know the person, just do a what they call it, chest compression on the middle of the sternum and just start it. No harm done, need not to be properly certified and all this, but that is very important because if you don't do it, even if it's a stranger, so you are just seeing somebody suffering in front of you until the person died. Yeah, so need not to be worried on if you do like COVID situation, you start CPR, will it be harmful for you and all that? If you're on your mask, just don't do the blow, just do your compression. That is our latest guideline. Yeah, so even in ambulance, we don't use the bagging and all that. We just use compression because the expired air may be dangerous for us if we do any ventilation. Yeah, so other than that, if you are talking about difficulty in breathing, which is most critical thing and the famous things happen during the pandemic now, any asthma or hyperventilation, all this you may not able to differentiate within, is it a normal suffocation of breathing? We just trade it to the worst as SOB, and of course, if we touch the patient, no matter whoever at home is not well and all that, just category 1 or 2 of COVID, it's fine when you touch them. After that, you wash your hand, most important. Yeah, so otherwise, I'm not sure whether am I answering you to the point again. You may want to ask more specific if you do have any doubts. Not only Chloe, of course, from the rest of the team members, Yiwa or anyone, you can just ask any question if you all need to. Yeah. Mm-hmm.
Sir, I have a question. So,
Yes.
when you are performing, first aiding, so how often do you use AED?
How often? Okay, AED combines in the idea where usually if we have what they call that, the patient no pulse, no breathing, whereby it's in a setting which is just like anywhere public area if you have AED. So in ambulance we use AED most of the time for the basic life supports ambulance. There are two types: basic life support, advanced life support. So most of the ambulance in town is basic life support, at least with an AED. So in every situation that patient cardiac arrest we do use. Yeah. So the last time I used is like 3 weeks ago. In our PPV, we have someone while waiting for the jab for second dose, collapsed right in front. So we started resuscitation on the center itself all the way to hospital. So this is something that need to use because AED is like your starter, to jumpstart the heart and all this. So no reason for us we don't have AED. And for the most basic level, everyone can use it, not to be licensed and all that. In hospital, what we give additional is just the drugs and all that, the medication. Yeah. Okay, Casey? Yeah.
You are St. John ambulance member, right, in your secondary school. So
Yeah.
I heard you are very active in the activity. So when did you get your first blue service shield? Is it called?
Blue service shield. What do you mean by blue service shield? I don't get
I
it.
think the St. John ambulance already get this on
There's
their.
bintang, is it?
No, yeah, something like the bintang,
Oh,
the
the
badge, yeah,
special hour service shield. Okay,
Ah.
I'll just share a bit further with you. Like, it's something that I'm very proud of during school time. So, we unfortunately started late. I start during from 1 year, but on public duty, you are talking about the duty hour shield. We call it special service shield. So, there are 5 category of them: 100 hours, 200, 500, 750, and 1,000 hours. Is that the one you were trying to mention? Yeah. So I get my first one during the when I'm Form 2, my July, I got 200 hours achievement. So to this moment, I still carry the whole nation youngest special service shield holder for 1,000 hours. I got my 1,000 hours during Form 4. Yeah. Yeah. So that is on the what do you call that? It's not something very difficult, but you just have to be consistent and volunteer yourself, lah. So need a lot of supports, and also from your families are most important, because my family don't stop me from volunteering. So that is why I'm able to achieve in that short period of time. I do stop about 3 months during my PMR period and all that, but all that doesn't really disturb me. Yeah. Mhm. Yes.
So after that, did you get your Grand Prior award?
Yeah. You happen to be a St. John member, you know, with
I'm very close with St. John, but I'm not a St. John, unfortunately.
yeah. I got my Grand Prior a bit late because what they call it, sometimes when you don't have the proficiency courses and all that, you were not able to attend. So I got it during my 18 years old, yeah. So a bit late, yeah, slightly late.
So after that, you become an officer, right? So an officer, you need to duty for ambulance service, right? So did you get paid for that or something?
When you okay, so there are two entity in St. John, if you want to know further, and same as Pbsm, because I have in my team we have colleagues which are formerly from Red Crescent, and they work in Red Crescent before, then they join us. We have such situations. So same two entity in which one is known as the volunteering entity, another one is as staff. Yeah, so I'm in both actually. So when we talk about volunteering basis, we don't actually have get paid the uniform whereby you have your shield or whatever. All that we don't. Yeah. So another entity is you are a staff or a consistent volunteer, then you may have a token of allowance. Of course, you compare. Why do we say it's a token of allowance? You can the price is not something that you expected. Same with private and all that. It's even lower than the government rate, so we call it as a token. Yeah, we started back then in my after I left Form 6, my shift, a single shift, which consists of 12 hours. I started with 30 ringgit. Yeah, so that is like my time when and that time is whereby I need to keep my own fund to proceed my further study. So we really work hard lah, work for long hours, but in the end of the day, is your mind more important, your mindset, whereby you need to volunteer more. It's not the money, is that you need to do more for the community. That is more important. Yeah, will drive you further. Mm-hmm.
Right. I actually have a question because I used to be a St. John member.
Okay.
Hey, sorry. don't do that. Okay. I was only St. John member in primary school.
Okay.
So I expected to continue that in Form 1, but
Yeah.
it's not available.
Your school don't have the persatuan, yeah.
Yeah, it's a lot of the case where St. John's are always in the primary school but not in secondary school. So I couldn't even reach cadet. So is there like an advice you would give to those students that want to continue on with St. John but then aren't able to?
Yes, okay. In volunteer wise, I think Red Crescent and St. John pretty much the same. Minta maaf Cikgu Nosham, I'm not trying to promote St. John here, but it's same thing applying in Red Crescent as well. So there are such thing as known as in Red Crescent, they have another term for it. I was helping in one of their setting up CAD. VAD, I think Red Crescent, they call it Volunteering Aid Division kind of thing in the national headquarters. So in St. John, yes, you can still join after your Form 6 as an adult member, whereby you can just write into the St. John National Headquarters. They will put you to the state headquarters or closer headquarters to have their person in charge to get in touch with you. Then they put you in the division to have you train for your first aid. For St. John, different with Red Crescent, that is that you need to be basic first. You need to pass your basic first aid before you wear your uniform, whereby Red Crescent don't. Yeah, so that's why it's more important to get you trained than before you join the service to volunteer further. Yeah. Mm-hmm. Still can, no problem. Don't give up, Chloe. Function the same things as well. Yeah.
Okay. All right. Actually like to ask.
Yes, please. Yeah.
Your experience, right? Is there
Yeah.
like a certain experience that you can't forget out of all these years of volunteering?
Oh, okay lah. Yeah. Because as I mentioned, every situation we kind of unexpected what will happen and all that. So of course we will be like a bit looks kebal because we have no chance to worry and all this. So used to be my relative able to they would pose this question to me. You do emergency, won't you feel very difficult to see certain situation which is maybe categorized as very disgusting and all this? But for us, that question will come into our mind with the answer to counter it is if that situation is very disgusting, we don't do it, who else? Yeah, so that is how we slowly take up. So it happened in many years ago when I first start my in the service of the Emergency Medical Assistance Service Department. My department name is EMAS KL, my very first department. So it's known as Emergency Medical Assistance Service. Yeah, EMAS. Yeah. So my very first night shift, that case I never expected that case a year later is not called as a court case. It's just an ordinary what they call it accident, but the patient died 2 days later in the hospital. So basically he's a drug addict and then he just crossed and just went into a very what they call it critical situation. So I still able to accept it because it's my first night. So whereby I come to my second night, oh, something bigger. 2011, if you are able to recall, there are one we call it as MCI, multi-casualty incidents, whereby in Ulu Langat you have a landslide. Yeah, the Rumah Anak Yatim. Yeah, so I'm there as the second team. The first team is it happens on 2 o'clock in the noon. So I went in at back to then is my working hour back then is 8 to 8. So we reached there at 8 until the morning. So I thought everything is perfect, and during the situation when I'm there and seeing whatever happened until the next morning. But the particular night duty, after going back, I'm not sleeping for the next 2 nights. I really don't know how to describe that, but that actually happened naturally. Then thereafter, slowly able to accept because in the very situation, it's a bit difficult for us to accept things which don't come by from the book. The children's that which is staying there is just primary school children and all that. So because I went in at the second shift, so the critical moment, those who were able to save in the situation which is alive has actually last until 9 o'clock only. So from there 9 o'clock until morning, basically they don't come up in one piece. Some of them they come up in pieces. Yeah, because the landslide is terrible. They don't die because of the landslide, but they die because of choking, suffocating of the rainwater, and with then thereafter only they get buried slowly. So you can see their features and all that. They are just happily playing around. Some of them is just in the situation like they are squatting. They are playing. So because after many hours, so their muscle is hardened and all that. So they come up in the position that you are really unexpected, like a normal dead body. So that is where, of course, and anyone with the heart of having compassion or passion in the line, they will feel it's not something easy to accept. Yeah. So I think that is why it happened naturally. I just couldn't sleep for the next 2 nights. I'm continue the next night duty. I'm all right. I'm just alert. I need not to sleep, but I can just carry on my duty. I'm not tired. But yeah, that's just make the what do you call it, the mindset is just flowing inside. But after that, I think not yeah, all of it is just acceptable. Of course, there are many, in the very same year, there are many MCI happen, like the Genting bus, which carry the students from Kedah, and then they overturned during coming down from the hill and all that. I was there until the very last team, whereby we step down, which actually that time we're just looking for one particular, because when you have pieces, you body not attached in one piece. You cannot just stand down like this. So that is a bit upset also for the case. Very sad for us to share as well. We are just looking for one partial of the head. Yeah. So in the end of the day, we found it in the middle of the lamp post, which have actually fall. Then the partial of the head is just stuck over there. Yeah. Many things happen when I just joined the service, whereby still in my mind now. Look, you route when come to like this is whether you believe it or not. Of course, you have to berhati-hati di Jalan Raya. But this road is one of the route that if I have one night shift during, especially the month of the Chinese say ghost month or whatever, have to be really careful. In one single night, it is not a joke, but 4 cases in the same road. Yeah, so the most serious case I came up in newspaper that time, whereby one of these couples in Myvi, Black Myvi, going to the connots, what do you call that, Pasar Malam, Wednesday night. So opposite car, a Muslim fellow, but we just don't know why and don't know how he get drunk and just crash over his car. And their car on the Myvi is like just left 1/3. We wonder where the engine are and all. We just couldn't imagine. So both of the couple basically it's not our duty to actually evacuate bodies out, but we just because we are there, so we kind of lend a helping hand and all that with the bomba. So I would say they are very brave. They were able to handle features which is not pleasant to share to anyone, but then we just have to face it. So basically the patient just half of the head got crashed in, and then the eyeball is just on the top and all that. Is not in a proper piece at all. So that's why I really respect them by how they handle. They just actually borrow a bandage from us, cover it, knife goes on, do their job. Yeah, have to. Yeah, so both of them very sad. They did on the spot, but the person who crashed them is just having what they call it, spinal injury and sent to hospital. Yeah. So yeah, anything can happen everywhere. So accident prevention, one of our proficiency batch, is very crucial skills that actually we always use the word of prevention better than cure. That is very important indeed. Yeah. So no one want to end up in a situation like forever paralyzed and all that. So everything could be prevented, just not on the trauma side, but medical wise. Yeah. So example, for our parents, grandparents, do at this junction whereby MCO they stay at home, always don't eat too full. Make sure everyone maintain good health. Example, when they're healthy, usually do some exercise, 70% full, and so that you won't have your high blood pressure and all this trigger. During this period of time, you will not want to visit hospital sometimes if you are not too serious with all this. So that is good for us to monitor them and to guide them in what you call it, better quality of life. Yeah. Mm-hmm.
Yeah. So when this situation happens, who put the remains in the bag? The paramedic
bag,
or
is
the
basically, police. You are saying the accident case, right?
Yeah.
Basically, all that will go to like police case. Yeah. So, example, we ambulance, we don't carry dead bodies. Totally don't. So even in a peaceful situation, died at home or anything, we don't. So they are one of these. You can see a bit kind same like a lorries. Police lorry, which known as Black Maria, like the model. If you go Google, you can just search it up. They will carry with that. So we don't handle all this situation, but only whereby when COVID patient died at home, we have to properly pack them. So sometimes not from St. John who carry all this, but from hospital wise, they will actually send the forensic team to actually clear it up from the situation. Yeah. Mm-hmm.
Right.
Yes,
So-
correct. Yeah.
Okay, so back to COVID, right?
Yeah. Okay.
A lot of the times, right? How do I say? Wait, sorry. I need to.
No problem. Yeah. Take your
Yeah.
time. No worries. Yeah.
because okay. Okay. Sorry. COVID. Sometimes, right, when people like they gonna COVID, right,
Yep.
they do have like symptoms,
Okay.
right? But how do they know?
Know they have COVID and all this.
Yeah.
Okay, so at this current moment, we would say if you're not feeling well, you just have to monitor. If it's prolonged, then it's good for you to do a what do you call that? Swab first. Yeah, there are two types of swab. One is PCR, another one is antigen. So at least the antigen one will actually filter the most what do you call that, common situation. So it is difficult for us to detect if it's asymptomatic, yeah, because you have no symptom and all that. So that against you will be shocked why your MySejahtera show you are close contact or casual contact in the term, yeah, happens. So you just have to be alert from there. Situation can be as simple as you are very severely tired while you don't do anything. That is also part of the symptom now, yeah. So maybe I would able to share you more, then you all would able to know what is the category like and how we define. So there are 5 category of COVID patient we have. Yeah. So Cat 4, Cat 5 is more serious. From Cat 1 I would share. Yeah. So category 1 whereby patient don't have any symptoms, we call known it as category 1. So when category 2 you have as simple as just as consistent sneezing, flu, on-off fever, any symptoms, you call it as category 2. So whereby category 2 and 3 is very close, because category 3 you do have all that, but you just have to the procedure is that you're a bit severe, therefore doctor will order a chest x-ray. Then from the chest x-ray we were able to define it as category 2 or category 3. Yeah, it depends on how severe the what they call that, the virus in your lungs reading 2 and 3. So when I come to 3 and 4, it have a bit overlap. That's why it's a bit difficult for us to define on the ground as well sometimes. 3 and 4, basically 3 you need to have difficulty of breathing. 2 not necessary difficulty of breathing. So when it comes of difficulty of breathing in category 3, category 4, if you ever know, I don't have it over here, I have outside, SpO2, the saturation. If anything drop 80 and below, which known as category 4 and above. If it still remain 90 and above, that is actually category 3. That means difficulty to breathing, but still able to breathe independently, not oxygen dependent yet at the moment. So 4 and 5, how does it different? 5 basically is a situation that drop really severe, really quick, and it need to be intubated. Intubated, that means you need to use a machine to actually ventilate them, and during what do you call that, when during the situation of category 5. So category 4 we do used to intubate as well with the previous SOP, but when there one time we have too many what do you call it, category 4 patient in the hospital, so they actually choose by case basis, if really needed only we do. So when they are like 85% SpO2 and it's still consistently dropping, then that might be still category 4, but we need to intubate them. Yeah, so that is the 5 category lah. So what the instruction from the government at this moment from our Kementerian. So basically category 1 and 2 can just known as quarantine kendiri at home, which MySejahtera will need you to update your sign and symptom, your situation every day. Yeah, so for 10 days, but if it's not going good, then they may need you to further have a second swab to clear it. Then only you need not to every day update that lah. Yeah, so that's category 1 and 2. Of course, we have patient category 1, within a day it can drop to category 4. We have many of the cases brought in that it happened like this. Yeah, it's because maybe age factor, number one. Number two is where they have chronic diseases. So it will just happen tremendously. I have one of my colleague, auntie, basically a day before telling us that she may need to go hospital, suspect case. The next morning went to hospital, afternoon intubated, evening passed away. Yeah, as quick as that. Yeah, so this COVID is something really have to be careful. We can come out, of course, when we need to. They are opening because of economy, like our DG mentioned. It's not because of it is safe anywhere you go. So therefore, SOP is indeed important. Yeah, you need when you go back, you need to be it you sweat or you don't sweat, you go to aircon place or non-aircon place or whatever, you just have to take a bath, and then maybe before you go into your washroom and all that, just let yourself sanitize the hand. If you have a pipe at what do you call that, right in front of your house, wash your leg first before you go in, and straight away go into your washroom. Your clothes immediately soak it with water and all that, and after you take your bath, don't think so it's safe as well. Repeatedly, where area that you walk by before, sanitize it lah. As simple as that. Yeah. We just follow certain procedure to keep ourselves safe. That is important. Yeah. It's unavoidable because it's nothing that we can see bare eyes. Yeah. So we have to choose to live with it, but live with it carefully. Yeah. Yeah. Right.
Okay, so we know that there's a Delta variant going around. Yes.
Yep.
Can you tell us more about it? Like what do you know about this?
Okay, so Delta variant, I think the latest update and studies in Malaysia is not up yet fully. So it's very subjective for me to clarify further. But as of DG latest update at this moment, may have certain suspected case in Malaysia, and it might be very dangerous. That is something that trigger faster than the normal COVID. However, when we talk about the sign and symptom, that is very difficult to differentiate on ground, in which the sign and symptom may just come in like just you have a normal COVID. So we are unable to share further on Delta, what do you call that? The criteria and all that at this moment. Yeah, just to treat it as COVID is scary enough. I would use the word. Yeah, right.
Okay. Hi. I'm curious about something. Like, I just want to know, how do you feel? Like, maybe do you mind to describe your feeling? How do you feel when you first see blood, and like, how was the situation at that time?
Oh, okay. Thanks, Eva, for your question. Nice to meet you, Eva. Situation I first see blood. I'm okay with seeing blood because okay. All right. So I may not answer you on that basis because I'm the person who able to see blood. So I do see blood in the very young age. Like when we talk about my volunteering service and as young as 14 years old and all that, even before that, I still okay to see blood. So I would maybe share with you what is more difficult to accept when you encounter with blood. Yeah. So I'm okay with seeing blood, but whereby I sharing the MCI case in Genting, that one, I'm okay to see blood, but because it's draining, dripping on the floor, it's really flooded with blood. So basically, over long hours, you may have the smell, even you have mask with you. So that triggers me that I can still remember until now. That is the first time that triggered me. Otherwise, still okay, blood is not as disgusting as what you think. It's like if the chicken that you are taking in your meal, if it is a bit too raw, it will taste something like this if you by smelling. Yeah. So how to encounter that is really on our mindset. We need to do the job. We need to stop the bleeding. So as much as you don't like to see blood, you stop the blood. That is the most subjective way to handle, the practical way to handle that situation. So you won't see it anymore. You see blood, you have any open wound, cover it with something that until you think that is actually doing the control bleeding, then you don't see blood bleeding anymore, that means you're doing a good job. Yeah. Okay, maybe I want to clarify further. More simple situation, you may have friend have nosebleed. Yeah, this is something that you don't cover lah. Otherwise, you have no other place to breathe. So what happens is many people may have a different treatment. You may just what they call that, ask the person to head tail so that the blood will have blood flow and all that. That is not the wise way. What we did in first aid, basically, if you ever learned previously, you can just put cold compression on this area, and then we can just slowly hold our nostril up here and until the blood stops, whereby you have something cold on top. So that will actually help the situation more. Yeah. Did I answer your question, Eva's? Eva?
Yeah.
Yeah. Okay. So you are the kind of person
Can you
who's
hear me?
yeah, I can hear you. You are the kind of person who scared to see blood, is it?
Yeah.
Are you? Oh, okay.
Like if there's a lot, then yeah.
Yeah, slowly over the time, actually, it shouldn't be a big issue, like, unless you are that severe of person that you see blood, then you faint on the next second. Okay, then that one is like, okay, like, we couldn't help you to control your mentally how you're going to handle the blood and all that. Yeah, otherwise, not much issue. Like, if something happened in front of you and you have no choice, you would able to handle it. Yeah, no issue.
After all this experience shared with us, do you have something that is until now you still think is when you think about it, you still feel very happy about it? The best memory when you are doing this first aiding service.
Share happy moment and all that. Yes, I do. Whereby I have this Atok, his case is just by a normal post accident case. He have a femur fracture, so I used to send him to hospital very often. For the first time, the family thought that he gonna gone, but thereafter 1 month later, he have a kidney issue, went into dialysis. He looked so bad, yeah. But after I basically handled the same case when I'm in ambulance service for about 3 years. His case, yeah. So he will want to look for budak Cina yang cakap Melayu bagus. Mana budak Cina tu? He always will look for me. Yeah, so I'm a bit very touched that the family also treat me like very close, and when it come to Raya Haji and all that, they will not forget me until a few years later he passed away. They will still call me and then ask me to, hey, come to share some ketupat lemang from the house and all that. Yeah, so I think when you are doing good, this have nothing to do with your race. When you want to help someone, is borderless. You just help sincerely, and things will come very surprised sometimes. Yeah, whereby example in PPV, sometimes we may thought the patient is a bit annoying and all that. So out of thousands patient and all that, there are 1 or 2 which will come in very polite way, and they will give you little surprise, maybe by just what do you call that, by a little piece of chocolate and all this. You will be like, huh, why these patients suddenly giving you things? You're just doing your job. So yeah, just do it genuinely when you want to do volunteer. So happiness is everywhere, I would say. Yeah.
So there's this case, like so let's just say a situation, right?
All right.
Someone is on the streets, okay? Someone is facing something like a condition or something. He or she is lying on the floor, and
okay,
it could be one of our students. One of us is standing there. Notice this kind of thing happen, right? So because even though first aid, you might not take the step to actually go there because you're scared that because you're not a doctor, you're not like a professional, you might not do it right.
Yeah.
So is there any words of encouragement for us in that kind of situation? For us to take that step.
All right. Yeah. So I might repeat certain things that I mentioned before, but that is really things that we can do. So you may want to throw in immediately on that situation. You may want to throw the same question to yourself, if not us, who else? So you just do whatever you want, you're able to do. And of course, if it's in a public, you can offer help. For example, you may want to just alert any medical staff, doctors, nurses around you that were able to help you in the same situation. After all, in medical, when we learn something, it's all standard. We can work in any situation or any medical setup without the person that we know of. Yes, because the things that we are doing, the procedure is the same. So pretty much have no worry to take the step out and do whatever you know how to do first before the professionals arrive. Yeah, of course, you can actually, you think you are not a professional, you may need another level. So like your DR, ABC, your R is getting the professional that respond. Upon no response, or we respond that you think that you need a professional with that, just prompt the ambulance service or prompt someone which is a professional to handle it. What you can do is monitor at least the pulse and all that, whether the patient is still breathing or not, breathing heavy or not, the quality of breathing and all that. So that is the least thing that we can do without bringing any equipment with us. Yeah, so that is very crucial as well. Note down the timing that you get it. So upon your handover, that will be very important, because if it's a cardiac arrest situation, timing is all about timing. We are buying time with for the patient itself. Yeah. Mm-hmm.
All right.
That's
All right,
correct.
understood. Thank you so much.
No problem.
Casey?
Okay. Actually, sir, I'm very happy because last time I was a scout member. Although I get the first aid certificate from St. John, but every time there's some accident happens, I didn't do the first aid. I always run back to school to ask the St. John for help. So finally, after 2 years, I finally can see one active St. John members here. So I'm a bit excited. So on behalf of our committee, thank you very much for your sharing the experience. And
Thank you so much. Before we end it, yeah, it's my pleasure to share as well. Thank you so much, Puan Nosham, and thank you, Casey, for hosting the section and all this. Is indeed my pleasure. So I would say doing something good is borderless, that all of us can just share and do together. I was a scout as well when I informed 6 rowers for the 2 years while I'm a St. John member. So sometimes it's not about uniform units, it's just about what we want to do beyond. Yeah. All right.